Hello, my name is Joy McMahon. I'm the Work Health and Safety and Return to Work Coordinator for Kalyra. Thank you for joining me for a 2020 training today. The topics being covered include what focus area Kalyra has for 2020, COVID-19, incident and hazard reporting, and what incidents and hazards we've had during 2020 to date, notification requirements, and injury management, including the early intervention program, staff physiotherapy services, and workers' compensation. Within the Kalyra strategic plan, safety is an enabler. It enables us to do our role, keeping ourselves and others safe. The key focus areas for 2020 include aligning the safety system with our business as usual, improving the quality of our incident investigations, looking at all manual tasks, incidents or hazards involving equipment and residents, and challenging behaviours. Unfortunately, during 2020, our manual task training was affected by COVID due to the limitations on group training sessions and the ability of staff to work across sites. Having said this, manual task coaches are available within the business. If you are having any difficulties at all with a manual task, please contact your supervisor so that a manual task coach can be arranged to provide you with assistance. During the course of our duties, it may be that a colleague requires some assistance with their manual task techniques. Failing to act on this increases the risk to ourselves and others of a manual task incident occurring. The manual task coaches have quarterly meetings with Pinnacle to assist with any difficult areas that they are having. The 2021 training is scheduled and dates will be released soon. Our plans for 2020 were somewhat disrupted by a pandemic, COVID-19. So whilst our focus areas didn't change, there was a whole new level of risks and actions associated with COVID-19. These included our visitor and staff screening processes, distancing and density, the PPE, and a whole lot of other things associated, both work-related and from a personal perspective. This has caused a huge amount of fatigue across society as a whole. Now, fatigue within the workplace can affect both your mental health, your ability to undertake your manual tasks, and distraction, which is resulting in slip, trips and falls. What can we do about this? There are some things we can do and there are some things we have absolutely no control over. What we can do is affect our immediate environment. By saying that, let's maintain attention to the tasks we're doing on a day-to-day basis. Support each other. If people are having a difficult time due to COVID or generally, support them in the workplace. Ensure you have a good diet and that you're hydrating well. The wearing of masks has affected some colleagues in the amount of fluid intake. Please don't let this be the case. Please continue to keep your fluid levels up, recognising that if a mask needs to be changed after this, then that's just fine. The number one recommendation to assist us in this difficult time is taking a walk 3 times a week. Now that's something very simple but achievable for us all. From a personal perspective, that's what I've commenced doing and I find it beneficial. So I encourage you to do the same. Now let's have a look at what incidents we've had in 2020 to date. As can be seen by the pie graph, Manual task incidents are the number one area being recorded. Within this pie chart, there are 34 manual task incidents, 20 of which are involving equipment and 14 involving residents. The consequences of a slip, trip, fall are significant. Please ensure that we keep to the designated walking areas within our workplace and the community as whole. Hazards reported to date during 2020 are listed on the pie chart. COVID hazards have been identified, particularly regarding staff and visitor screening. Along with that, manual tasks involving residents and equipment have been proactively reported. I think it's important that we recognise the job the maintenance department do in keeping us safe. In 2020 to date, there have been 170 instances where faulty equipment has been reported to maintenance, so thank you for those that have been reporting them. Remember, if there is faulty equipment, ensure it's removed from service and labelled appropriately. When working around the workplace, please ensure that you keep an eye out for electrical equipment that is currently tested and tagged. The carers and hospitality staff are in our residence room very frequently. You're best placed to identify a hazard should this occur. Please report general damage to the maintenance department as soon as you become aware of it. It doesn't matter who caused the damage. Open communication by reporting this will ensure that our residents' home is maintained to the best standard. The maintenance department have over 5,000 requests for assistance this year to date. Please ensure that all requests are logged on the maintenance reporting system and don't simply ask a maintenance worker when they're passing. In addition to the above, the chemicals within the workplace need to be constantly monitored. There is a chemical register on SharePoint should you require any detail about the chemical you're about to use or any hazards associated with that chemical. In addition, first aid requirements are also listed on the SDS. Please ensure all chemical labels within the workplace are clear and legible and that the content of the container matches the label. Please ensure the Work Health and Safety Department are advised of any new chemicals entering the workplace. Incident and hazard reporting. Self-safety is the mechanism by which we report all incidents and hazards. Please proactively report any incident and hazards in a timely manner. This can be done either by utilising the icon on your desktop or asking another staff member to report that for you, such as a RN or CTO. We want to ensure these are captured on Self-Safety to reduce the likelihood of a colleague being hurt, providing support for any treatment or recovery, analyse the data for our safety system, and ensure that Safe Work SA are notified where required. We have obligations for the notification of Safe Work SA regarding any notifiable incident. A notifiable incident is listed on the screen. It's not only applicable to an employee, but contractors or member of the public. Please ensure you advise your immediate manager if any of these instances occur, so the Work Health and Safety area can be advised and notification made. The graph on the screen indicates how our injury frequency rate, so that's the amount of incidents that result in an injury per man hours worked. Very simply, the orange line up the top is how we're performing in 2020 compared to 2019 and 2018. The columns below are the amount of employees in each month that have sustained an injury in the workplace. Staff physiotherapy services is available at all aged care facilities at Kalyra. Please contact the reception at each facility to make a booking. The staff physiotherapy service can cover up to 3 physiotherapy treatments for both work and personal injuries. Extension of this can be obtained by contacting the director of your business or myself. Kalyra have an early intervention program for work-related injuries. This can cover up to 3 general practitioner consultations, 5 allied health treatments, 2 days lost time from work, and up to a week of modified duties. An extension of this can be obtained by contacting either the director or myself. This does not prevent a workers' compensation claim from being lodged, but purely enables staff to access treatment in a timely manner without necessarily the requirement of lodging a claim. Kalyra is self-insured for the purposes of workers' compensation, and we manage our claims in-house. What that means is Kalyra apply the legislation to determine and pay entitlements under the Return to Work Act. Please ensure you support your colleagues in the recovery and return to work process. If you have any queries regarding workers' compensation, please do not hesitate to contact me. Kalyra has the Employee Assistance Program, and this is counselling that is offered for both personal, work or any reason at all. The counselling is confidential, it's independent to Kalyra and provided by experienced counsellors at no cost to you. This covers up to 3 consultations, which can be extended after speaking with your director or HR manager. In summary, participate in making Kalyra safe for staff, visitors, residents, clients, anyone that enters our premises. Do this by completing an online solve safety within 24 hours, being vigilant with residents and Kalyra equipment and the environment, have open communication regarding new hazards, a change of care or a better, safer way of doing things. Use the manual task techniques trained by Pinnacle, and don't be afraid to ask for assistance if encountering any difficulties. Support colleagues within the workplace, including those participating in their recovery and return to work. If you have any queries about any of these topics, please do not hesitate to contact me. After this presentation, there is a brief quiz that I ask you to complete. Thank you for your time.